Welcome. This video is for educational purposes only and is to inform patients and their parents or guardians about Blau syndrome. During this video, we will explore all things related to Blau syndrome, including the genetics, signs and symptoms, what to expect, treatment options, health risks, and complications. Blau syndrome results from mutations in the NOD2 gene. Normally, the protein produced from this gene helps to defend the body from foreign invaders, such as bacteria and viruses, by playing several essential roles in the immune response, including inflammatory reactions, with the most common example being a rash. In Blau syndrome, this gene mutation causes the protein to become overactive, which can trigger an abnormal inflammatory reaction. Although it is not exactly clear how this overreaction affects the immune response, it is known to cause a specific pattern of inflammation, primarily in the skin, joints, and eyes of those affected. Your doctor will explain that Blau syndrome is known to be an autosomal dominant inheritance disease. This means that even if one parent has the NOD2 gene mutation, there is a 50-50 chance of each of the children having this disease. However, it should be noted that this disease can occur even if neither of the parents have the gene mutation, as it can occur spontaneously, meaning it can happen without any family history of Blau syndrome. So, as we have discussed already, Blau syndrome is an inflammatory disorder that primarily affects the skin, joints, and eyes. Signs and symptoms begin in childhood, usually before age 4. A form of skin inflammation, called granulomatous dermatitis, is typically the earliest sign of Blau syndrome. The skin condition causes a persistent rash that can be scaly or involve hard lumps that can be felt under the skin. The rash is usually found on the torso, arms, and legs. Arthritis is another common feature of Blau syndrome. Affected individuals will experience swelling and joint pain, which begins in the joints of the hands, feet, wrists, and ankles. As the condition worsens, it can restrict movement by decreasing the range of motion in many joints. Also, most people with Blau syndrome also develop uveitis, which is swelling and inflammation of the middle layer of the eye, the uvea. Uveitis can cause eye irritation and pain, increased sensitivity to bright light, known as photophobia, as well as blurred vision. Other structures in the eye can also become inflamed, including the conjunctiva, the tear glands, the retina, and the nerve that carries information from the eye to the brain, known as the optic nerve. Inflammation of any of these structures can lead to severe vision impairment or blindness, as outlined here in the vision impairment distribution. 73% of patients will have normal vision, while 11% will experience moderate visual impairment, and with 16% who will experience blindness. Less commonly, Blau syndrome can affect other parts of the body, including the liver, the kidneys, the brain, the lungs, the blood vessels, and the heart. Inflammation involving these organs and tissues can cause life-threatening complications and therefore warrant treatment in order to suppress such complications. Given current research on Blau syndrome, the optimal treatment has yet to be determined. However, moderate to low-dose daily corticosteroid therapy has proven to be somewhat effective in controlling uveitis and joint disease. However, the side effects of prolonged use of corticosteroids may become intolerable for the patient as they are very hard on the young developing body. Another drug called methotrexate, dosed once weekly, is effective in suppressing disease activity and allowing less or even discontinued use of corticosteroids. Even better yet, the introduction of anti-TNF monoclonal antibody agents have even a more hopeful outlook for the future of this disease. These are drugs that are used in other inflammatory diseases such as Crohn's disease and ulcerative colitis, and they may constitute a major therapeutic advance in the treatment of Blau syndrome. Blau syndrome is a chronic and progressive disease with a variable and often unpredictable spectrum of severity. In cases with expanded manifestations, life expectancy may be reduced. That is why it is important to discuss care and treatment with your doctor and genetic counselor. For more information, visit the National Society of Genetic Counselors at nsgc.org to begin your treatment for yourself or a loved one today.